The focus of our work at the Medical Ultrasound Engineering Laboratory is biomedical ultrasound. We work on both diagnostic ultrasound as well as therapeutic ultrasound. Some particular areas where our work is focusing is molecular imaging, tissue characterization using ultrasound, therapeutic ultrasound including focused ultrasound surgery, and drug delivery and immunotherapy using ultrasound.
The main research efforts of our work is to develop and translate ultrasound-based techniques for treatment, management, as well as diagnosis of diseased tissues. Our lab is multidisciplinary. We use principles of biomedical engineering, acoustics, medical instrumentation to be able to develop these technologies for addressing healthcare needs. Currently, my projects consist of three major areas. In particular, looking at imaging the stiffness of tissues. We have projects that work on developing algorithms for measuring the viscoelastic properties of tissues. We also look into imaging tissue structure based on quantitative ultrasound techniques. We are also investigating techniques for imaging blood flow.
The main aim of my thesis is to develop an ultrasound-based imaging technique for early detection of oral cancer. Ultrasound elastography can be used to differentiate between healthy and cancerous lesions by estimating the tissue stiffness.
We are developing an optical hydrophone to detect ultrasound waves. And for this, we are using a highly reliable and sensitive fiber optic sensor known as fiber Bragg gratings or FBGs. Now, these sensors are small, lightweight, and these sensors can also detect temperature in addition to acoustic pressure.
I try to explore the alternatives to antibiotics. So in this, I am using an ultrasound to excite a chemical called sonosensitizer. Right now, I am trying to optimize the ultrasound parameters which are being required to generate the maximum amount of loss.
My work focuses on the quantitative ultrasound. So as compared to the conventional ultrasound, quantitative ultrasound gives us the system independent parameters.
We at MUSE Lab at IIT Gandhinagar synthesize various types of phantoms that are used for ultrasound approaches for imaging and therapy. Phantoms are created to replicate the native tissue's acoustic, mechanical, and thermal properties. They are made using different types of materials, and that material depends upon the tissue of interest. Here, we have developed novel polymer-based viscoelastic phantoms that are used for ultrasound approaches.
My work is in the two ways, like photoacoustic in vitro diagnostic of photoacoustic spectroscopy and characterization of protein-shelled microbubbles. And these microbubbles are used as a medical imaging contrast agent in the diagnostic ultrasound and as a nuclei of cavitation for the therapeutic ultrasound.
My work focuses on the assessment of blood flow in the microvasculature. I am working on ultrafast Doppler and super resolution. Using ultrafast imaging, we can achieve up to 10,000 frames per second. This allows us to image blood flow with high sensitivity and temporal resolution. Super resolution imaging enables us to capture microvessel images at unprecedented resolution beyond the diffraction limit.
My work is mainly focused on the non-linear acoustic characterization of ultrasound contrast agent, which are used for the enhancement of non-linear ultrasound imaging, particularly as ultraharmonic imaging, subharmonic imaging, and others.